Hello and welcome to a very special episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and today we are talking AIDS, HIV awareness. December 1st is World AIDS Day, and I wanted to do a special episode to commemorate the lives that we lost and to give a wink of support and a hand of support to those that are still in the fight. Today's guest is a very special lady. I'm happy to have her join me, and we're going to talk about some amazing things that are happening right here in the Twin Cities. This is going to be a very special episode you won't want to miss. I'm so excited to have you joining me today and to have this conversation. It is not only, we are in the month of December, the first actual day of December has passed, where we celebrate World AIDS Day.
Yes, the 35th anniversary of World AIDS Day.
35 years. That's a long time.
Yes, it is.
Well, before we get started, can you introduce yourself to viewers, those that may not be familiar?
Yes, I am Val Ruben Rashad Crutcher. I am the Executive Director of the Youth and AIDS Project. So I have been there. This is going into my 27th year, although I was just born 2 years before that. But
okay. Can you talk to me about the mission of the Youth and AIDS Project?
Yes, our mission is to support and inspire and break down barriers for young people affected by HIV.
And how long has YAP been doing this work?
So YAP has been around since 1989. There is Dr. Gary Ramafetti. He was part of the University of Minnesota, the Department of Pediatrics. And he said if young people are engaging in the same behaviors as adults, why do we think they're not at risk for HIV? Hence his research project started. And there's been many projects along the line, but now we focus on care, HIV care and prevention, and we are getting back into research.
Wow. How has the experience of partnering with the University of Minnesota been thus far, being in the Office of Pediatrics, as we talked about?
It depends on the day.
Okay.
As an employee, we do get a lot of perks being associated with the university. However, we are fully grant funded. The university does not pay for any of the programs. We are just housed there, and they are our fiscal agent. Okay. Although I am an employee of the university, but we operate as a nonprofit.
Okay. I wanted to make sure that we delineated between that for those that may say, I'm interested in the resources, but I don't necessarily want to have to go on to campus and try to navigate some of these things.
Located on
how
campus.
Close?
Yes.
This
Thank you for
work?
saying that. We are not located on campus either.
Absolutely.
We are located in the city, so we are very easily accessible, and that's on purpose.
Okay, and we'll talk a little bit more about that towards the end of the interview. Now, currently, the governing philosophy of YAP is that adolescents can and do make responsible health-related decisions, given appropriate resources and support.
Yes.
Can you talk about the nature of that, but also how did you guys come to such a specific language around that work?
In the state of Minnesota, young people are able to make sexual health decisions for themselves at the age of 13. And so that's part of it. Young people can get birth control, they can get things around like their sexual health. They can make those decisions at 13. And if they have appropriate resources and knowledge, we can be confident that they do make good decisions. And they have. I've seen that over the years. There was I'm still in touch with her today. There's a young woman that I worked with. I met her when she was 14, pregnant, and found out that she was HIV positive. Now she is a mother of 5. Her kids are in college. She's married. She's living a thriving life. So given appropriate resources, she was able to make those good decisions for herself.
Now, over the 27 years you shared with us that you've been doing this work, how have you seen youth having the power to make these decisions around their own health? How have you seen that change throughout the years? What has the impact of that been?
It's been very impactful. Young people, one, we need more resources. There's not enough. But when young people find out what's available, it's actually knowing that there's places available that can help them. It's having access. So once young people know that they could have access to certain resources or help, that's what's most impactful. So we need programs like this to get the word out that there are resources out there, that young people don't have to be alone. Not a lot has like magically changed over the years. It's just letting young people know that there's resources out there. And once they know that they can access these resources, then they can move ahead with their life.
Now, I'm sure many people probably thought it's a little early to start talking about AIDS, HIV and AIDS awareness and prevention in a pediatric arena. But when we look at the numbers from the CDC, I have some in front of me here, those aged 13 to 34 are accounted for 58%. That's 18.7 thousand of the estimated, new HIV infections. That leaves room for about 32,100 as of 2021. Yes. As compared with 2017, the annual number of infections for that same age group, 13 through 34, were down 18%. The age 13 these are young people that are dealing with life-altering situations on a very serious scale.
Yes.
I don't think we have the room to say what's too early to provide people with necessary and poignant healthcare information.
Yes. I embarrass my daughter sometimes. I have a picture of her. She was probably 8 or 9 years old, and I would take her to sexual health fairs with me because I've always been in this business, and I have a picture of her with gonorrhea. They're like, people, are you talking to your kids at like 7, 8? Yes, they need to know these things.
It's true.
They need to know how to protect themselves. They need to know, what's out there. So it's not too young to start talking to your children.
Can you talk to me about some of the services that are being offered through the Youth and AIDS Project?
Yes, we offer non-medical case management, which means we have support and referrals around housing, mental health, food shelves, transportation, for instance. We offer medical case management, and our medical case management is going to focus on the overall health and bringing HIV down, or bringing the virus down. So getting people undetected, because Minnesota, I'm very proud of Minnesota, we were the 3rd state to sign on to undetectable equals untransmittable. So it's very important that, which also means that if someone is undetectable and they stay that way for a period of a few months, but if they stay undetectable, they're not going to transmit HIV through sex. So our goal is to get our clients to undetectable. So the medical case management will focus on that. We also have, we have a treatment adherence program. So if someone is having difficulties taking their medication, we'll give them more support around treatment adherence. We also have HER group, which is Health Education and Risk Reduction Group. So it's a time where we discuss different topics, but it's really meant to build community, so our young people know that they're not alone in this. We also have a prevention team where we provide HIV testing, syphilis testing, and PrEP referrals. So PrEP is the 1 pill once a day that someone can take if they may be at risk, so they don't get HIV.
Okay. I appreciate you sharing that, because I'm sure somebody heard that and said, PrEP, what is that? And before they had to Google, they can get an official definition. How have you seen this multi-pronged approach of service provision, research, and teaching work at YEP?
Thank you for asking. So, like I said earlier, Dr. Gary Ramafetti started this as a research project. And in the 80s, we were the only organization in the country that really focused on youth and HIV. So when people wanted, knowledge around this topic, they would come to YAP to get those resources. So what we do now, in the research that we do now, we did a COVID HIV and youth research project. So we'll be able to disseminate that information and give best practices. Being connected to the university and the Department of Pediatrics, we have access to residents, doctors who are going through the residency program. And so we are establishing a program where these doctors will work in community, so then they'll have a better sense of how they can work with young people. Instead of coming with the high-level doctor speak, they'll know, okay, I've been in this community, I've talked to young people, this is what they're concerned about, this is what I need to take my time with. So we're also training doctors to work better in community. So that's how our multi-pronged approach works, besides service.
How can we actively work to reduce the stigma around AIDS and HIV in our community? You've been at this for such a long time, and as we are celebrating 35 years of commemorating this very, very powerful thing, it's like, where do we look? Normalizing HIV testing would be one. I do believe that in the state of Minnesota, if a woman's pregnant, she's offered an HIV test. However, if she's 35, white in the suburbs, they may not offer her an HIV test, thinking that she's not at risk. So normalizing HIV testing for everyone. Knowing that I still get questions like, HIV is still here? Yes. Yes, HIV is still here. It's affecting our community. Why is it affecting our community? So asking ourselves those questions, talking about it, learning about it, talking to your kids about safer sex practices, talking to our kids about, mental health issues. If we see that, our kids, or if we're struggling with addiction, mental health, knowing that, we can get help, because all of those things can bring HIV into someone's life. So just knowing resources, talking about HIV, and knowing that it's not a death sentence anymore, and it's not a gay white man's disease. I think that's very important to share. I think it would be nice to share another fact from the Center of Disease Control. More than 40% of new HIV cases in the U.S. occur amongst Black people. So you're speaking to that it is not a gay white man's disease. We are dying in droves.
We are dying because we all know we have a mistrust. A lot of Black people have a mistrust of the medical system. When you talk about, we can talk about Minnesota. I'll just talk about Minnesota. We make up 4% of the population here, but we make up over 34% of the population living with HIV in the state of Minnesota. I have lost 4 young people this year under the age of 34 who are living with HIV and AIDS. So we're dying. We're dying. We need to know our status. And that's the main thing. Like I said, normalize testing so we know our status. It does not have to be a death sentence. There are medicines that will, it can be a chronic disease, but you can live with it. People can live with it until old age, but they have to know their status and not be distrustful of the medical system.
I think you're right about that. For Black women specifically, 91% of new HIV infections were attributed to heterosexual contact, while HIV infection rates among Black women were the highest among all other races and ethnicities. How do you see this day to day in your work with YAP?
You know, someone asked me how has my job changed over the years. Mm-hmm. When I first started this job, it was really young gay white men that I worked with. And then it switched. So YAP right now, we serve about 96% of our clients are young people of color. Mm-hmm. There was a time where on my particular caseload, I had the same amount of Black women and Black men mm-hmm. on my caseload. I think right now the population of Black women that are getting infected is a little bit older. So I do see young Black women now, mm-hmm. But a lot of our men. I'll also say this: 17% of men who go into prison come out HIV positive.
Can you say that number just one more time for those?
17% of men who go into prison come out HIV positive. Minnesota arrests Black men at a rate higher than any other state in the union. So we just think about that. Mm-hmm. So a lot of our men who go into the system and come home to us, it's not like, they're necessarily all living on the down low mm-hmm. and they're bringing, HIV to their wives, but men are injecting drug users, so they can get it that way. There's so many ways that it can come to us through heterosexual sex.
I think that's a very important fact to share with the public. How has the community received the work through the Youth and AIDS Project? What has been the reception like?
We have very good collaboration with the community and other ASOs. I have a jacket on that is represented of MA, the Minnesota African American HIV Association. That it's a consortium of ASOs in the community between mm-hmm. Rainbow Health, African American AIDS Task Force, Indigenous mm-hmm. Peoples Task Force. So we all work together collaboratively to do what we can to combat this disease and get the word out.
I think that's wonderful. How do we support the work at the Youth and AIDS Project if we are not only interested in volunteering or lending financial support? What can we do?
That. Volunteering and financial support. When I do an ask for money, I say $10 will give a young person 10 rides to the doctor, because we are with a program called TAP with Metro Transit. Mm-hmm. $25 will pay for an HIV test, an at-home HIV test. People can take at-home HIV tests if they don't want to come into YAP, although we do go out to the community to give HIV testing. But really the support would be getting the word out that HIV is still a thing, mm-hmm. volunteering at YAP, financial support, and not even just to YAP, but to other organizations, and we do HIV AIDS Day on the Hill, mm-hmm. and talking to your representatives and legislature, saying that this is still an important issue, an important topic.
If you've wanted to know how to plug in, she just shared some wonderful ways that you can not only support the amazing work that's going on, but also really impact the youth and people that they are working with every day. Yes. I think it's a powerful way and a really wonderful time to put our money and our talents and time where our mouth is. If we want to see this reduced, we're going to have to step up. We can't wait on someone else to do it.
Yes.
Can you please share with us the ways in which we can stay connected to the Youth and AIDS Project, whether it's a physical address, social media handles?
Yes, so you can find us at yapmn.org. Also YAPMN on Facebook and Instagram. You can call 651-231-4849. That's that's not my personal, but that's my work number. Mm-hmm. So I'm always available that way.
I know that so many things service-wise have shifted throughout the COVID-19 pandemic, and we are still very actively in the throes of this for people that have believed it has left. Can you talk about how YAP has plugged in with COVID research and the assistance there for the community?
Yes, so we have done research and we're getting that information compiled with how COVID has impacted our young people living with HIV. We've shifted where we did do remote work, so now we're more hybrid, so we work from home and come into the office. We have provided in-home HIV testing for those who didn't want to come to the office to get tested for HIV. And then we also promote events around the city for folks to get vaccinated as well as HIV testing. So if folks want to know where they can get tested, they can also go to the MDH website to get tested. And now would be a good time, not to plug incentives, but a lot of places are offering quite a bit of incentives to get their COVID vaccinations.
Okay.
You just have to go to the MDH website to see when the next vaccination site is.
Okay. So we'll definitely make sure that people are Googling the Minnesota Department of Health or the health department in their state so that they're able to navigate not only vaccinations but also testing.
Yes.
It is not over, ladies and gentlemen. COVID-19 is very active. Please make sure that if you are not feeling well, you are staying home, you are wearing a mask, and that you are always washing your hands. We have to try our best to not only keep germs at bay, but also to stick around for those that are near and dear and those that may be ill around us. And the best way to do that is by making sure that we keep ourselves as clean as possible and that we're making the best decisions for ourselves and those around us. And lastly, I just want you to look into that camera there and just to share with viewers a message of support, encouragement, whatever you prefer.
As we celebrate the 35th year of World AIDS Day, I would just encourage folks, even if it's Googling an article on HIV, learn about Ryan White services. There's ways that you can get involved. There's things that are happening all throughout the month. You can go to Minnesota Department of Health and look at their website to see what's happening and to see what's happening in our state around HIV and AIDS. And I just encourage folks to, again, like I've said throughout this interview, normalize HIV testing. So if we know our status, we can stay healthy.
Thank you so much for your amazing work and for your commitment over the last 27 years to such a necessary and poignant cause. Please keep up the great work, and thank you for joining me today.
Thank you.
Unfortunately, that is all the time that we have for this episode of Community Connections. As always, I am your host, Anna Orr, and a very special thank you to Val Rubin Rashad and her amazing team at the Youth and AIDS Projects. It is a very necessary time of the year where we are able to give to one another and love on one another, but we cannot forget the least of these who are hurting and deserve our time and attention. In the world, every minute, there is somebody that dies from HIV and or AIDS. This is preventable, and this is not a death sentence. So if you or someone you know can benefit from any of the resources shared today, please share them within your networks. I am Anna Orr, and I look forward to connecting again with you soon.